Hello. Thank you for joining this Neurology Live Peers and Perspectives presentation titled Management of Sialorrhea in Parkinson's Disease. I'm Dr. Stuart Isaacson, Director of the Parkinson's Disease and Movement Disorders Center in Boca Raton, Florida. Sialorrhea is a common symptom of Parkinson's disease that can cause both physical and social consequences and impact the patient's quality of life. Today we are going to talk about some of the challenges of identifying Sialorrhea and current treatment options to best manage it in Parkinson's disease. To discuss these challenges, I am joined by Dr. Richard Trosch, who is a neurologist specializing in movement disorders at the Parkinson's and Movement Disorders Center at Michigan Healthcare Professionals in Farmington Hills, Michigan. Thank you so much for joining us. Let's begin. So, Richard, can you tell us about this problem, Sialorrhea and Parkinson's disease? How common is it? Why should we care about Sialorrhea and Parkinson's disease? They have so many other problems. Why is this a problem that we're talking about today?
Well, first, it's a common problem. Most patients with PD drool, and most have Sialorrhea. It's thought about 75% have drooling. It's not all severe. A significant number will have severe drooling, and this can be problems. The anterior drooling, it's drooling that comes forward, or oral incontinence where the saliva is coming beyond the lip. It causes excoriation. It can cause intimacy problems. It affects speech. But we're also concerned about the posterior drooling. That's the saliva passing over the tongue into the oral pharynx and possibly into the lungs, which can be a cause of aspiration pneumonia. Particularly at night when patients lie down, a lot of patients will give you the history that when they lie down at night, they cough. And they're coughing because they're aspirating their secretions. And aspiration pneumonia is still the number one cause of death in Parkinson's. So posterior drooling is a very serious symptom.
So is it due to too much production of saliva? Is that why people have this type of drooling?
Actually, in PD, the production of saliva is reduced versus normal controls. What their problem is clearance. So Parkinson's patients don't swallow as often, and we're always producing saliva. We make about a liter and a half a day, but we're constantly swallowing the saliva. But in Parkinson's, there's reduced swallowing, but there's also impaired swallowing. That's why so many of these patients with Sialorrhea also have dysphagia because there's impaired swallowing. And so if it isn't clear, the saliva pools and it's a liquid. It follows gravity. If the head is down, it comes forward, and we're going to call that anterior drooling. If the head is back, it goes back over the tongue into the oropharynx through the isthmus, and they may have aspiration.
So, we think about this problem with drooling overnight on the pillow. This can be an early sign of early diagnosis, and certainly patients very advanced may have more drooling, especially posterior problems as well as anterior. But where in the spectrum of the disease do you start paying attention to it?
That's a good question. I used to think that, well, once it's getting on their clothing, they're really not managing it. Or if it's evident where you see the patient who comes in your clinic and they're carrying a tissue and they're constantly dabbing the corners of their mouth, or you see drool on their chin. But that's probably pretty severe. But there are studies suggesting that patients who have this nocturnal Sialorrhea where they don't drool during the day, but their pillow is wet, when they wake up in the morning, they're probably having silent aspiration as well. So that's probably the point where we need to get involved. If someone says, well, I have a little extra saliva in my mouth, I don't drool, I don't know that I need to treat that person. But if they wake up and the pillow is wet and there's obvious drooling during the daytime or the clothing is wet, those patients, I think we should intervene.